the question of the role of the peripheral immune system in primary progressive MS is a difficult one. So we know for many years that we tried several drugs that work mainly on the peripheral immune system, and most of these drugs didn't have a significant effect in delaying progression. So we believe now that part of the cause, let's say, of the progression in primary progressive multiple sclerosis is driven by cells within the nervous system. And we believe that microglia and maybe astrocytes have an important role. However, we also know that B cells are involved, and this is particularly coming from data of Ocrelizumab, which is an anti-B cell therapy that was shown to delay progression in primary progressive patients. The thing is that this delay in progression is not a complete halt or a complete stop of the progression. And so we had doubts about the role of B cells in this. What we now understand is that probably B cells coming from the periphery are important, as well as with the progression of the disease, B cells that are activated in B cell follicles, ectopic follicles that arise in the meninges. So we have a contribution of B cells coming from the periphery, but also from those that coming from the periphery enter the brain and are activated there in these ectopic follicles. So I think there is still a role for drugs that work on the periphery in two ways. First, if we have very strong drugs that can really suppress B cells in the periphery, because we know that these cells are the ones that then enter the brain and are activated there. So if we strongly suppress them in the periphery, we might see an effect. And there are some ideas about this with new drugs. The other thing is that if we treat these patients early enough, we can even prevent the inflammatory events in the brain that then can lead to the activation of the brain resident cells and the formation of these follicles. And these can also have a huge impact in progressive MS. So yes, there is still a role for cells in the periphery in the pathophysiology of progressive MS.